Good evening, everyone. We meet again after some time. I hope you all had a very good Diwali. Now, today's topic, you have already had literature review, right? You have had what to do with literature, etc. How to do a literature review, types of literature review has already been covered. So now we're going to talk about how do you read published research. Now, how do you understand whether the literature that you're reading is good enough for you to review or not? So that is critical appraisal of published research. Critical appraisal means you are going to appraise the article, whatever you're reading, for research rigor. Because if research is not being done rigorously, then the evidence that comes out of it is probably not evidence or not high quality evidence. So that is the whole point of doing critical appraisal of articles. So basically you're looking at, is it a good article in terms of research rigor. Research rigor means sampling, the type of design, the type of statistics employed, whether they have used randomization, etc., etc. So these are the things that you're going to be looking at. Now, all of you at some point must have done journal club where you talk about, is this good, is this not good, etc. So that is one way of reading. There are other ways of reading. So when you're reading research output means it can be an article, it can actually be even a critically appraised book, a book or a compilation. It can be systematic reviews, Cochrane reviews. It can be clinical practice guidelines. It can be anything. All of this is research output. So when you read research output, there are ways of doing it. Some of us read just like that for orientation. This is what's going on. What are the kind of articles that are there? What is the kind of research that is happening? Is there anything new out there? That kind of thing. So that is reading for orientation. You're not really looking at research rigor or anything. You're just trying to see what is there, what might be happening new that you are not aware of. Okay, that is reading for orientation. Sort of like when you read a magazine. Then you're reading to understand newer concepts. Understanding newer concepts you would use with something like a rapid review or a structured review. You are reading it, you're not thinking too much about the research rigor perhaps, but you're seeing if the article has structure, if the article has a clearly articulated research question. So you're doing some part of this. This is typically what master's students do at journal club. You're reading for understanding of newer concepts. So you want to know what do they do for stroke hand now? Okay, they do CIMT. So you're looking at how was CIMT done, or what is the inclusion criteria for doing CIMT. You're not really looking at whether the research was done, whether you're not really too worried about the number of samples and all that. You're looking at something else. Then you're reading to distill evidence. To distill evidence means you are looking at it in a very structured manner. You're reading to see if there is a new concept. You're reading to see if the concept has been described adequately, if there is adequate literature, theoretical background for it, if the research has been correct, if the methodology is strong, if the data analysis is appropriate and strong, if the results are talking about everything that the research question aimed to find, and so on. So this is where you start doing critical appraisal. And you're interested in how the research was conducted. Then you read to develop research questions, which is what actually you do at the beginning of an MPT. You're trying to get a research question for which you read for orientation, you read to understand concepts, then you read to see is there any need for further research, that kind of thing. So that is to research, that is to develop a research question. Okay, now When you come to the parts of the research, now different journals will put this out in different ways because the outline may be different in different journals. But basically, what are you looking at? You're looking at a strong background. Is the background clear enough? Is it really making a strong case for need of the study? That is what background must be. So background must be comprehensive, and background must bring about what is the need for the study. So that it should focus. Then you're looking at an objective or a hypothesis. If it is an experimental study, you will have a hypothesis. If it is just an observation study, you will have objectives or aims. So you're trying to see if the objective and the hypothesis or the hypothesis are clearly articulated, if these are answerable questions. So these are things you will look at. Then you will look at methodology. Is the methodology appropriate for the objective or the hypothesis? Is the methodology in line with background? If everybody else has done it one way and this particular article does it in some other way, is there justification for that? So you're looking at methodology, whether it is in line. Then you want to know how the data were managed. Were the statistical tests appropriate? Was all the kinds of whatever is necessary done? Was there too much data dredging? Did they set out to do something, but then they started saying so many other things that are really not relevant to the research question, or which was not the original aim, and the methodology was not designed for that? That is called data dredging. Then you want to look at results. Are the results given clearly? Are you able to understand? When you look at a table, are you able to understand exactly what they're trying to put forward? Then you want to know discussion and conclusion. Discussion, you want to know whether they have discussed it in light of earlier research, especially in light of the background, and have they brought out new concepts, new hypotheses, new reasons, or anything? What does this research add? What does this article add to the body of evidence? And you want to know what is the conclusion. So to practice evidence or to develop a new important research question, what do you need to know? You need to know what is already published. You don't want to keep on reinventing the wheel. So you want to know what is published. You want to know if what is published is strong, which means does it clearly say that XYZ is the treatment of choice for OME? Does it say something like that? If not, is it strong enough to say that it is not? It can be in either way. So you want to know if there is strong published literature. If there is strong published literature, there might not be any point in you redoing the study. But if there is still a question, the question is still not effectively answered, then yes, you might want, there is a lacuna. Then you want to know if what the research has done is feasible, is it necessary, is there meaning in using it in clinical practice? Is it possible for you to do it in clinical practice, either in terms of economical costs, human costs, or time and effort? Or is it too lofty, or is it too niche that you cannot use it in everyday practice? Then you want to know if it is cost effective. Cost effective does not mean cheap. Cost effective means is there value for money. They are saying that this particular treatment will decrease the number of sessions by 5, but it is 3 times more expensive or something like that. But perhaps this additional cost is justifiable because the number of sessions and the human effort and everything else that goes into it can be compensated. You want to know if it is effective and if it is efficacious. Efficacious and effective are two different things. Efficacy is, does it actually have a meaning to the patient? Effective is, does it show research evidence? So that way, you're now looking at research validity. So critical appraisal is all about internal validity of the article. So you're looking at research validity. How valid is the article that you're reading? So there are 4 kinds of validity is the extent to which the conclusions are believable and useful. So believable is talking about ethics and also about feasibility and so on. Usefulness is effectiveness and efficacious, cost effectiveness and so on. So basically, Cook and Campbell have described 4 types of research validity. Is it Is the research designed so that there are few alternative explanations for changes in the dependent variable other than the effect of the independent variable? That is type 1 error. Can you, has it as effectively controlled for type 1 error, and have they put in enough controls for confounders? Now, all of us know that in rehab research, it's very difficult to do a very blinded controlled study because it's very difficult, because the patient has to cooperate. Most of our outcome measures, in fact, are dependent on the patient's voluntary effort and so on. So these might be confounders. The patient's attitude, beliefs, the patient's age, gender, these might be confounders. So are there enough controls for confounders? Now, of course, this depends on the question. If the question has to be generalized to the entire population, men and women, then the controlling for confounders will be addition of men and women in equal proportion or something like that. But if you want to do this only for women, then obviously you need to have women. So this is homogeneity, in other words. The second type of validity is, are the research constructs defined and used in such a way that the research can be placed in the framework of other research within the field of study? Which means the constructs, what are they trying to measure? What is their question? What are they trying to measure? So these must be clearly defined so that it can be compared to existing research. Because as all of us know, plagiarism is not allowed. So I cannot write the same question that somebody else has written, because that will become plagiarism. So I would word the same construct probably in a different way, but my study and somebody else's study would be comparable because we have studied the same construct. So research, there is a saying that we stand on the shoulders of giants, which means we are not coming up with any new idea really. Whatever idea we have is because of work that has been done in the past by other researchers, greater people, that is the giants. So we are standing on their shoulders, and we must never forget that fact. So whatever we are doing must gel with what has been already done. So this is another way of looking at, this is another validity construct. So if there is poor definition of constructs or inconsistent use of constructs, it is a threat to construct validity. The first one is face validity, second one is construct validity. Then to whom can the results of this research be applied? Now, all of us are doing clinical research. So clinical research has to be useful to patients. Otherwise, there's very little reason, very little point to it. So that is what the third one is. Is it externally valid? So is there validity to your population? Is there validity to a similar population? So sampling design factors that can lead to limited generalizability are threats to external validity. If they have taken a group who are 10 years and 1 month old, they are all boys of 5 feet 2 inches height. They all weigh 35 kgs. What's the point? It's too stringent, and your general population is not like that. So there is limited generalizability to the population that you would want to generalize it to. So this would be a threat to external validity. Too homogeneous or too heterogeneous, both of these. So if it is too heterogeneous, they have taken any and everyone who walked in, then again there is a problem. So these are sampling and design effects. Are statistical tools used correctly to analyze the data? So irregularities in the use of statistics are threats to statistical validity. So statistical validity is whether what has been with statistical validity is this is statistics that has been done, the correct one basically. So if you're doing normality curves, then if it is not normal, you do non-parametric statistics, etc., etc. You want to know whether it is one-tailed or two-tailed. Are you expecting it? Are you expecting the results only in one direction? Can it go in either direction? In which case you need two-tailed. So these are the statistical tools, not just whether you have used t-test or ANOVA. It goes deeper than that. Are correct statistical tests used? Are the statistical tests used correctly and interpreted correctly? And is there any irregularities in the use of statistics which may be a threat to statistical conclusion validity? Because finally, all of our research is going to extrapolate the conclusion from the statistics. So if the statistics is not strong enough, then it's a threat to validity. Coming to research validity, little bit more detail. Research validity includes design. Design is, there are many types of design. So you have broadly you have qualitative design and quantitative design. In qualitative design you have different types, in quantitative design you have different types. So for your question, is the design appropriate? So if you are trying to find the efficacy of a treatment modality, it has to be an RCT. Without an RCT, you cannot comment on it, you cannot reach any conclusion on effectiveness or efficaciousness. So it has to be RCT. If you want to look at general trends, you want to know the natural history, then you will go longitudinal cohort study. So like that, the design must be appropriate for the question at hand. Theoretical constructs, including measurement methods, must be clear. They must be applicable and generalizable in statistics and interpretation. Theoretical constructs, including measurement methods. So this is very, very important for us. And that's the purpose of measurement. There are a lot of outcome measures which have been made in other cultures and in other languages, which if you take as is, will not have the validity that the original tool has. So measurement methods must be, you must analyze, critically appraise the measurement methods and find out if these are applicable to your population. Does it require any modification? Is modification allowed within the construct of the original validity, and so on and so on. So these are things that we need to take a lot of effort on, outcome measurement. And of course, the management itself. Now, if you are using some esoteric instrument which is not available to most of the people in India, there might be little applicability or generalizability to your article. So these are the things you would think about. And then statistics and interpretation. So these are the considerations during critical appraisal. So in short, an article may be highly critically acclaimed in the US, but we might give it a low score because it has no validity or no external validity to our population. Okay? Now, internal validity is the strength of association between intervention and outcome. So there should be a theoretical background for why you are doing the intervention. That is where the background will make it clear. There must be a strong theoretical background for why you want to do CIMT in a stroke of 5 years old. In a 5-year-old stroke, because as far to the best of our knowledge and with current understanding of stroke, most of the recovery has already happened. So why would you do it at that late stage? So you need some strong theoretical background. And what is the outcome that they're expecting? Is the outcome that they're expecting perhaps less pain in the shoulder or something like that, and not function? In which case, the theory may not be very strong actually. Because when we talk about stroke recovery, we are talking about return of function. So if their outcome is something else, then there might be a theoretical background. So these are the things you must look at. What is the measurement choice and what were the strategies, including relevance of measurement and following of operational guidelines? So what was the measurement of choice? If the measurement of choice was not available, they took the next best. How well does this correlate with the gold standard? And using this, you will interpret whether the results are gold standard results or less than that. Then, what strategies have they used for maintaining measurement properties? For instance, did they talk about in test retest reliability? Did they try to establish the stability of the instrument before they actually undertook the study? Have they mentioned what is the test retest reliability, intra-tester reliability, inter-tester reliability, and so on? Or are these things already well established that they don't need to describe it? That is also okay. Then, when did they do measurement intervals? Now, this is one very common thing that you see in thesis, etc. You do some intervention. I mean, you have a study. You do something, and then you do QoL. And then you do some intervention, and 3 weeks later you do QoL again. Now, do you really expect quality of life to change in 3 weeks? No. Even health-related quality of life, as we know from psychology and physiology, requires quite a bit of time to actually change. So if you see a change, it's probably measurement error. Measurement error because measurements are done by the patient and by the instrument. I mean, error can be in the patient or the instrument or the therapist. So measurement intervals must be clearly thought about so that whatever change in measurement can actually be captured within this interval and not just randomly choose whatever is convenient to you, because then it decreases the internal validity of the study. Then you need to look at natural history of disease or disorder. Has this been thought about? So if you're saying that CIMT will increase hand function in acute stroke, all of us know that the large majority of stroke victims, stroke survivors may actually recover naturally if they go within the number of hours and to the doctor and they get the appropriate medication and so on. So, how have the authors how have the authors justified the fact that it was their intervention that caused the change and not natural history of disease or natural recovery? For this, one of the easiest ways is you wait for you wait for the period to get over sometimes, or you have a control group who are within the same period of the disease or disorder. So you can say these people improved more than the control group, and hence this was an additional benefit, and it was not due to natural history of the disease or disorder. So depending on the article, you need to look for this. You need to look at behavior and contextual factors. All of you must be familiar with the ICF domains where contextual factors, personal and environmental, affect everything from health condition to participation. So, how have behavior and contextual factors been controlled for, or what have they done about it, or have they considered it as limitation, which also is okay. Then you want to know about statistical regression to the mean. Statistical regression to the mean is those who initially, if someone does very badly and another person does very well, after some time, the next measurement, both of them will come more towards the center. This is called statistical regression to the mean. It is natural. So if there is very little change in measurement, it could mean that it is because of regression to the mean. Then you want to look at sample size and attrition. So what is the sample size? Has the sample size been adequately accounted for? Have they given the right formula? Have they accounted for design effect? Anything that is non-random requires more number of non-random sampling, requires more number of participants in order to control for what is called the design effect. So all of these things you must look at. And what happened? Did everyone who were recruited complete the study? Was there a large dropout rate who had to keep getting replaced? So these are all considerations that you will, because then these are all threats to internal validity. Their original plan did not pan out. So they wanted 30 participants. They got 30 participants. After the first 2 days, 15 of them dropped out. So they got 15 more through convenience. And then after 2 days, 10 of them dropped out. So they got 10 more. These kind of things are not good. That is a threat to internal validity. Then assignment logic and selection criteria. On what, have they described adequately how they assigned participants to different groups? Have they given any justification for allocation concealment or the kind of blinding done, or if there was more than one researcher, what they did? These are the things you want to know. And you want to know what is the selection criteria. We already talked about this. If it is too homogeneous, it may not be generalizable. If it is too heterogeneous, it may not be strong enough. Was there any contamination of groups? For instance, if you have a large gym and you have doing a study, so So one group is experimental, the other group is control. Now this experimental and control are coming at the same time or very close. One is supposed to come at 1, the other is supposed to come at 1:30. So this 1 o'clock guy comes late, 1:15, and so you don't have a slot open, so you tell him to wait. This 1:30 guy comes at 1:15, and it's not yet time for him. So 15 minutes they're sitting and talking. That could cause contamination. So he's saying, hey, what are you doing? I'm doing this, this, this. Oh, really? I'm not doing that. I wonder why. So he goes home and he also tries to do that. Okay? This is all contamination. So, and he may not tell you that he has done it. So you are thinking this control group has not done anything, and the control group actually improved as well as the experimental group, and you're confused. So these are things you must think about, contamination. Then you want to look at conflict of interest, bias, ethics, bias. So you want to know if there was, actually, in this case, you want to know the article. If the authors have control for contamination, you want to see if the authors have control for conflict, have disclosed their conflict of interest. Either that they were paid by anyone, or they were students, or something like that. So these are, it could be positive or negative, conflict of interest. Construct validity, the variable as defined and the variable as understood. So if the construct is unclear, then for instance, if you say function, we very often do this. We say, I'm looking at functional recovery. What do you mean by functional recovery? The variable as defined, function does not really have a definition for research. So the variable as understood by the people, by us who are reading, might be that you're talking about gait. You're talking about lower limb recovery. So the variable, they might have talked about lower limb recovery, and the reader is thinking it is gait. But the researcher is actually talking about improvement in ankle range of motion. So these kind of things can happen. So if the variable is defined and the variable is understood, must be clearly mentioned. The definition must be clear. And if there is lack of clarity of construct, same thing. Function. If you say function, there is no clarity of the construct function. Function can be anything. It can be anything. It can be musculoskeletal function, as in that the muscle is working. It can be anything. So there should be clarity. If there is inadequate representation of the population with the adequate construct. So if one of the variables that they're looking at is effect of gender, and if there is inadequate representation of one sex, then that would be a threat to construct validity. Then rater bias. If the raters have bias has not been taken into consideration, that is intra-rater reliability, those things are rater bias. So that, or if the rater is the same one who is doing the exercise, then there might be bias. So these are things that should have been disclosed, or they should have been controlled for. And what is the interaction between variables? This is very, very necessary to look at, especially when you're doing something in acute case. Because, like I said earlier, there is a process of natural recovery, and there is a process of a natural history of a disease, and there is some recovery always happens after some time. And if you are doing something and the patient may have recovered because of natural processes, physiology. So that would be an interaction between the variables, what you are saying and natural recovery. Or if there is medication. Some medication has been given that, for instance, let's say wound care. So if you are doing ultraviolet and they're giving some antibiotic proteins or something. So you don't know whether the ulcer got better, whether it is because of ultraviolet or whether it is because of the medication. So this would be an interaction between variables. So these should have been controlled for. How do you control for? You have a control group who also is getting the same medication, but that did not get ultraviolet. That kind of thing. External validity, generalizability. I already told you this many times. If it is too stringent criteria, it may not be generalizable. If it is too vague, it might be not strong enough. Then therapist and tester experience. Therapist and tester experience is another component of external validity. If you are talking about, let us say, manual therapy. Some very, very highly sophisticated manipulation technique, and there is a study on it. So most of us the average manual therapist may not be proficient or competent in doing that particular technique. So then there is very little generalizability because only a very few people can actually do the study. So then it's not going to be very useful. And the time factor. When was this done? If the study was done years ago and the theory has changed considerably over the period since when it was done and when it was published, then there might be no validity to the study that you're reading. And like I said, this is applicable to our population, to our practice. This is another thing that you have to look at. Statistical validity, again I told you, data analysis methods must be appropriate and they must be adequate. They must be appropriate, you can say ANOVA, but there are different ways of doing ANOVA. There are different ways of implementing ANOVA. So that is whether the statistical methods are adequate. So there are many ways these will be covered in later classes. And any attempt to dredge data to find relationships that are of questionable value, to set out to see if A will improve with B. Then after that, during the process of the study, you find C, and you find that D improved because of C, and then that is a conclusion that you're saying, although your original idea was totally different. So this is considered dredging of data, and sometimes it is mostly not appropriate. You can sometimes dredge data to a certain extent in order to bring about future research topics, to hypothesize something else. By the way, I saw this. It was not the purpose of my study, so I'm not going to conclude anything about it. But I noticed that this happened. It's an observation which needs to be further studied. So that's all you can do with dredged data. You must not draw any conclusions. And whether the statistical results are appropriate for clinical interpretation. So statistically, if you have large number of data, then p-value will become less than 0.05 just because of numbers. So that does not necessarily mean anything. So if you have done something and mean difference in pain score was 1 on VAS, 1 centimeter on VAS, and it is and the p-value is 0.001, but it has no clinical value because all of us know that the MCID for VAS is 3 centimeters. So anything less than like 2.5 to 3. So anything less than 2.5 centimeters is not considered to be clinically important. It is chance. The patient has drawn it little bit this side, little bit that side. So that's what it means. So statistical results must be interpreted in light of clinical importance. Now, this is what we are looking at. Okay, these are the things that you must look at when you critically appraise a study. Now, how do you appraise a study? The ways of appraising studies, there are many. One is unsystematic, which is what most colleges do in first year MPD. You give them an article and say find faults. So you say, oh, the title is too long, the title is too short, the title is too silly, and whatever. That is unsystematic, and you are finding faults. You may not necessarily even be focus. You may be finding faults, you may be finding no faults. That is okay, but it is the criticizing, not critical appraisal. Then there is systematic manners of doing this. Systematic manner of doing this is using validated appraisal tools. There are many validated appraisal tools available. Some of them are very short, some of them are checklists, some of them have a score, some of them are meant for RCT, there are many that are meant for different types of research. And then there are some that are specific to rehabilitation research, because rehabilitation research has many things that medical research does not have, many constructs. So there is one called Critical Appraisal Skills Program, or CASP. So that is you can see. You can enter that website anytime, and they have number of appraisal tools for all kinds of studies. So they have a qualitative one, they have one for cohort studies, they have one for this, they have one for that. There are many studies. Many tools. So CASP is a good resource. Pedro will only talk about RCTs. Pedro you must all be familiar with. And then there are some that are specific to rehabilitation research. There are some that are very generic, like Juddard scale and so on. So these are ways of doing critical appraisal using a systematic tool. Now, how to find the best tool? There are systematic reviews done on systematic appraisal, systematic tools done on appraisal tools. So these get uploaded every once in a while in AHRQ, and you can find the best one. But the problem is some of them are paid, and most of them are for medical research. So these are some problems. But you need to find an ideal one for your study. So now, how do you do a systematic appraisal? First of all, you need to read the article. You simply read the article to evaluate external validity specifically to us. And see, is it even important for me to go through the trouble of reading this, understanding it, looking at the statistics, assessing the statistics, critically appraising? That is the first point. Is it even worthwhile? Is the study even worth my time? Then if it is, then you choose an appropriate evaluation tool or appraisal tool. Choose an appraisal tool that is appropriate for the study design, that is appropriate for the construct. Then you rate it. Meanwhile, while you're rating it, you also simultaneously write down any descriptions. Oops, sorry. Okay. You also simultaneously write down descriptions for internal validity, sorry about that. Oh, shucks. Okay. Sorry. Simultaneously, while you're writing it, you also simultaneously write down descriptions of internal and construct validity points. So you find out anything that seems not okay, that is a construct in line with the background, all those things. When you're reading, you might get ideas that are not there in the critical appraisal tool, so write this down. Then, as there is judgment, see, critical appraisal, especially if you're doing a systematic review, is obviously it is based on judgment. So judgment is how is judgment? How do you get judgment? With knowledge and experience. So since there is judgment, it is necessary to have 2 to 3 opinions so that you can come up with consensus. Because you may read something and understand something, someone else may read and understand something else. So when you talk together, there might be the construct might become clearer. So it is always necessary to have more than 2 opinions. And research theoretical constructs that is propounded by the authors. That is the other thing that you need to think about. Are the research theoretical constructs that the authors have written, is it really a theoretical construct or not? And another thing is, are you familiar with the theoretical construct? If you're not familiar with the theoretical construct, first you must go back and read a textbook and understand the theory before you do a critical appraisal. Then some other points, when you have outcomes, and outcomes are the outcomes are subjective, not blood report or anything like that. Then a separate appraisal of outcomes and study is indicated because outcomes itself need to be appraised. So if you have dash, which was made in let's say in English, and these people have done the study in Turkey, and they have done everything. The study is great, but they have not taken the time to validate the Turkish version of dash, and the whole study is shot because the outcome, what they're considering as the outcome of interest itself is not appropriately done. So you need to separately appraise the outcomes. Is the specificity adequate? Is the sensitivity okay? Is the MCID okay? If it's something was translated, do the original properties of have they done enough research to find out whether the original properties of the the properties of the original article are carried forward to the translated version, and so on and so on. When you finish this, finally you will list down strengths and weaknesses along with your critical appraisal score. Then you identify. Then you decide what what happens here in evidence. So you have identified the evidence, whether it is because evidence is hierarchical, but evidence is not just hierarchical. It is systematic reviews will be the top of the pyramid. But if a systematic review is not done properly, then it does not become 1A. It falls. It becomes 1B or sometimes even 2 if it is poorly done. So that is where this critical appraisal comes in. It is not just the hierarchy of the study, it is also the conduct of the study. Then you identify evidence and potential scope for further research. I'm done. Any questions? Any questions?
Yes.
Yes, tell me, Zina.
So, ma'am, if at all, supposing you spoke about conflict of interest, so if a study, supposing a part of a study is funded by a university, which is not like supposing my thesis, which was done in Manipal University, and a part of my tool which I used was from McGill University in Canada. So then my conflict of interest becomes positive.
No. There is no conflict of interest there because the conflict of interest would be if McGill gave you money. If McGill gave you money in any manner, scholarship or anything, in order to validate this tool in India, then it would be a conflict of interest, which only means you have to disclose it. You have to say this study was partly funded by. That's all.
Okay.
Not like it becomes a bad study or anything. You have to disclose conflict, if any. Mainly, conflict of interest comes with pharmaceutical companies which want to market their drugs. So, since there's a lot of money in clinical research, researchers may fudge data. But in our case, the same thing can happen with equipment companies. So if there is a new laser machine, and if I am told that if you produce a paper out of this, I'll give you the machine which costs, let's say, 1 crore to you for free. Then I might be not because I'm a bad person, but unconsciously or subconsciously, I might tend to be biased, and I tend to put the people who I think will have better outcomes in this group rather than that. All of this is conflict of interest. So in our case, it's really not very serious. It's more than drug research, but this is something that can happen.
Okay. Thank you.
Yeah. Any other question? No? Okay. Thank you. Good night. And sorry I had to postpone. Something happened. I got stuck in traffic. Thank you. Bye.